Well, what I was talking about was the importance of air pollution as a major drive to adverse human health across the entire life course, from conception to death in old age. And we concentrated very much on talking about particles because these are the things that have changed so much since we had the Clean Air Act of 1956, where we had quite big particles and sulfur dioxide, to where we are now, where we have very small particles and a different chemistry making them up. And we talked about how they went into the human system by being breathed in, circulating, ending up in organs, and then causing inflammation in those organs, accelerating non-communicable diseases such as heart disease, dementia, asthma, COPD, and other non-communicable disorders. The important thing about this was that the particles, of course, are much more heterogeneous than we ever imagined they would be. And one of the places we don't know too much about is the indoor environment. And a great focus can be thought of in terms of what we've done with wood burning in our homes recently, is to increase the amount of particles in our indoor spaces, which are as toxic as the burning of coal in the old days. So the indoor environment is really an important area for exposure. Well over 80% of our time is spent indoors. We have a different mix of chemicals. We have the outdoor ones that are coming in, but then we have the ones that we contribute ourselves with the various personal products, the cleaning products, the burning within our homes, gas cookers, etc., etc. And of course, this is really important because over the last 50 years, we really don't know much about these chemicals and how they're impacting on human health. So what we need now is research focused on that. This meeting has brought together several people who are actually speaking on that topic. So we've got new data coming forward, and I think those data are actually reinforcing the importance of getting to grips with this problem. Yes, air pollution has an impact. Out of sight, out of mind, so people can't see it. But I think a good comparator would be tobacco smoking, which affects multiple organs, as we all know. And this is obviously a different mix of chemicals, but the principle is the same, is that we are breathing chemicals in that are damaging us. And those that are living in the poorer environments of our society are those that are most exposed and those who are contributing the least. And again, that applies to the indoor environment as it does to the outdoor environment. Well, recognizing the medical importance of all of this, we did update our Royal College of Physicians report in June of last year and came up with 19 recommendations, really, which in essence comes down to one thing, that we've got to move the debate from an environmental problem and discussion to a public health discussion. And we've got to get out there and help our public understand how air pollution is damaging them and what they can do about it. What we're really talking about here are the chronic long-term life course effects of these air pollutants. And I think the important thing that we said in our report really is that we would like now for a public health campaign to help the understanding of why air pollution is important and what the greater public can do about it themselves. Well, the industry, of course, are part of this solution, because if they understand what the nature of the problems are, then they will adapt materials that are low-emitting materials and obviously will diminish the exposure that humans have in the indoor setting. This has to be marvellous. I mean, this is actually industry building a new way of constructing where they're using low-emission materials that are going to have great health benefits going forward. We need to connect health with exposure. So one of the great breakthroughs in the outdoor air story was that the epidemiology, that's the community-based collection of medical information, when mapped against air pollution exposures, they were able to demonstrate a positive interaction, i.e. when air pollution got worse, these health conditions all got worse. We do not have those data for indoor air. So we need epidemiology to be now focused on the indoor environment. It's a big challenge, but it's certainly one that's doable. And to be able to achieve that, we need to get industry and other organisations, such as architects and those that understand the nature of buildings, to be able to help in the design of such studies. It is a policy direction. I think connecting the health data from electronic case records in primary care and in hospitals with air pollution monitoring data across the entire country of nearly 70 million people. Can you imagine if we actually understood which were the drivers in all of that were creating the coronary heart disease, the dementia, the diabetes, etc., then obviously this would be a transformation. And I think it would empower government and others then to really start increasing the cleaning up of the air towards healthier air, which is what we all need.